Hi, everyone. Thank you for joining us today. My name is Callie Hassinger, and I work with the Center for Financial Planning, and we are joined today with Joel Nogueira. He is an employee of HealthPlanOne or HP1. He's a sales manager, and he has worked in the Medicare insurance industry for 10 years, primarily in sales and management, and he has worked with HP1 for the last 3 years, so he has a lot of Medicare experience, and he's going to walk us through some of the Medicare basics, and then also explain how Raymond James and HP1 have partnered together. Hi, Joel. Thank you for joining us.
Sure, Callie, I appreciate the invitation. It's my pleasure. We've been working with Raymond James now for several years, and it's worked out really, really well. It's been very beneficial for both companies. What we'll talk about in the presentation is, for those that are already on Medicare, it'll be a little bit of a refresher, and we'll talk about some of the different options that are going to be available as we near the annual enrollment period from October 15th to December 7th. And for those that are new to Medicare, it'll be a little bit of a breakdown of what are the things that you can anticipate as far as choices and different things that will be available to you. So I'll talk a little bit about our relationship with Raymond James. HealthPlanOne has been a company that's been out since 2006. We really started off as a lead generation company in the beginning, but we've grown to become a very big brokerage. We have over 360 brokers across the U.S. And now, out of those 360, we have a very small dedicated group of about 35 agents that are really our most knowledgeable, our most experienced. They're the ones that work with the Raymond James clients. And we really strive for making sure that, our Raymond James partners have a really fantastic experience when they contact us. We're available to answer any questions, and there's never any charge for anything that we do. Also, we represent multiple companies. We're not tied to any particular one. So we have a very unique advantage of being able to discuss several of the major companies that are in a person's area and make sure that they have all the options that are available to them. So we'll start covering some of the basics of Medicare. Part A is going to cover your hospital stay. And with Part A, you would be responsible for in 2019, a deductible of $1,364 for every time that you visit a hospital. Now, Part A is typically something that's going to start automatically when you turn 65. Even if you're still working or still have coverage, you'll receive a card, and typically you will have Part A start automatically. The only time you do not want your Part A to start automatically, and you're going to want to postpone that, is if you are part of an employer program that offers some type of funding into an HSA health savings account. If your company is funding the health savings account for you, you have to delay your Part A. It's an extra step that you would need to take. Again, a lot of these things are situations where when you contact us, part of our analysis is going through these things with you and making sure that you're making the right decisions. But keep in mind that for everybody else, typically Part A is going to start when you turn 65. And again, it only covers your inpatient hospital stay. Part B is going to cover all of your other needs when it comes to medical. It covers your doctor's visits, emergency room visits, outpatient, any lab services. All of those things are covered under Part B. Part B, there is a premium that you would have to pay, and the premium is based on your income. The standard amount for 2019 was $135.50. If I'm not mistaken, that's going to be the same standard amount for next year as well. So it's $135.50. Now, Part B is something where you have the option of delaying it based on type of coverage that you currently have. So if you're turning 65 but you're not ready to retire, you have the option of postponing your Part B, and you will not be penalized as long as you maintain credible coverage through some other type of either independent coverage or employer coverage. Again, that's something that we would discuss when you call in, and we can do a comparison of your employer coverage versus Medicare coverage and trying to find out which one will be more beneficial for your particular situation. Part B does have a yearly deductible that you have to meet before it kicks in. It's $185. And then after the deductible, Part B covers 80% of your cost, and you're responsible for 20%. Now, 20% doesn't sound that bad. Most employer plans cover 80-20. The big difference with Medicare is, though, Medicare does not have a cap on the amount of charges that you can receive versus any other type of employer plan. You always have some type of a maximum out-of-pocket protection in case of a catastrophic situation. Medicare does not have that. So that's very important why you would want to add some type of additional coverage to protect yourself in case of a catastrophic situation. For the Part B, there's a chart here that shows you what you would be responsible for. Now, something that's interesting about the Part B premiums is they don't look at your previous year. They actually go back 2 years when they're looking at what your income was. So, for example, if your Medicare is going to be starting in 2020, your Part B premium will be based on your tax returns for 2018. Okay? Now, you are allowed to update your Part B income once. So typically we have customers that retire, their income is different once they retire. They will have an initial Part B premium. Within a couple of years, once they are now looking at retirement income, they can submit a change and have the amount of the premium adjusted based on their new income once they have their retirement income in place. The third column here, which is, sorry, go ahead.
I was just going to say, this is a chart that we're very conscious of when planning for our clients. We're obviously always thinking about tax brackets and tax planning, but we're also trying to keep our clients within or below that $170,000 cliff if possible.
Yeah, great point. The third column here, which is the IRMA, the IRMA is what's called your income-related monthly adjustment amount. That's the surcharge that you're going to pay on the prescription drug portion, so also based on income. So if you have a higher income, you're going to get you in a higher amount in two different places, on your Part B premium and also on your prescription drug coverage. So, as we discussed, Medicare definitely has some gaps that you're responsible for. You're responsible for your 20% co-insurance. You're responsible for deductibles for hospitalization visits. Also, Medicare does not cover anything related to dental, vision, or hearing. So those are things that we have additional products that we could recommend based on a person's needs, but a lot of people are a little bit surprised to know that Medicare doesn't cover anything relating to those. But the biggest gap for me, again, is the fact that that 20% does not have any maximum amount that you reach. So you are responsible for that whole amount. A couple of different ways that you're going to be able to take care of and protect yourself. The first one is by keeping your original Medicare Part A and B and adding a Medicare supplement plan, or also known as a Medigap plan. Medicare supplement plan would work as a secondary to Medicare. The advantages of a supplement plan is it's a little higher on the premium, but it covers just about all of your costs, and it gives you the ability to be able to see any doctor, any facility, anywhere in the country that accepts Medicare. You never have to worry about any type of networks when it comes to a supplement plan. The other nice thing about supplement plans is they are standardized. So when you're looking and comparing supplements from one company to another, you are comparing apples to apples. So it makes it easy for you to be able to search for a plan that's going to have a solid reputation and a solid premium. The second route that you can go is what's called a Medicare Advantage plan. Medicare Advantage plans are also known as Medicare Part Cs. Those are Medicare Advantage plans. They combine your Medicare Part A, your Part B, and a prescription drug plan into one plan, and they're administered by third-party companies. So basically, Medicare allows these companies to take over your Medicare for you, and the reason they're able to do it at a more cost-effective way, which is why Medicare allows the companies to do that. And those are your companies like your Humanas, your United Healthcare, your Aetnas. Those type of plans are your HMO or your PPO plans. Very similar to employer-type plans, much lower in premiums, but you have some out-of-pocket costs that you're responsible for. You have co-payments and different co-insurances depending on the plans. And again, one of the big things that we do when we sit down with our clients is do an assessment of the things that are important to them. we present all the different options for them, and then we allow them to make a choice based on what they feel makes the most sense based on their situation. The other nice thing about a Medicare Advantage plan is it does include a prescription drug plan built into it, versus if you're doing a supplement, you also have to add a separate prescription drug plan to go along with it.
Is there a specific client situation or circumstance where you see that Medicare Advantage or the more traditional Medigap plan is more appropriate?
Callie, we found that with most of our Raymond James customers, the supplemental plans typically seem to be a more cost-effective way of doing it for several reasons. One, you're paying one flat amount and you're having everything taken care of. So you're not going to be surprised with any high out-of-pocket cost. And especially for customers that are wanting to protect their assets, it tends to be a plan that makes more sense for them. The other upside of doing a supplement plan is, and we'll talk a little bit more about this, but when you first start Medicare, you are protected from Medicare where you do not have to answer any medical questions or do any type of underwriting in order to be in a supplement plan. You're guaranteed acceptance. So that's your window of opportunity to get on any plan that you want and not have to worry about being turned down. Once you lose that window, if you went on a Medicare Advantage plan, a couple of years later changed your mind and wanted to switch because maybe now you're having more out-of-pocket medical costs, you'd be subject to underwriting and may not qualify for a supplement plan. So we do find that particularly with our Raymond James clients, I would say a high 90 to 95% opt for the supplement plan.
Okay, that makes sense.
So the other component of this is what's called the Medicare Part D, which is referring to prescription drug plans. Medicare does not cover prescriptions at all. So you have to add some form of prescription drug coverage. And as we discussed a little earlier, depending on the route that you go, if you do go with a supplement plan, you do have to purchase a separate standalone prescription drug plan. If you go with a Medicare Advantage plan, it would be combined in the all-in-one plan. The interesting thing about prescription drug plans is they do change every year. So one of the things that we do have with our clients is they do call us back year after year, and we do a new reassessment of their current situation and make sure that whatever prescriptions they're taking, whatever plan that they're on, still makes sense for them for the following year. We really emphasize to our customers not to take for granted that just because their prescription drug plan automatically would carry over if they don't do anything. They still want to make sure that there hasn't been any major changes in their prescriptions or on their plans, or there hasn't been any formulary changes. So we always recommend that every year you do another assessment of your prescriptions and make sure that the plan is the one that makes the most sense for the following year.
That's one of the biggest complaints I hear from clients is how expensive prescriptions are. When you have a list of an ongoing prescription, the cost can get up there.
Yeah, exactly. And this next chart will show what the big difference is. When you're on an employer plan, your prescriptions are very easy, right? You're either going to pay a copayment for generic or a copayment for branding, and it stays consistent throughout the whole year. You don't have to worry about how much in out-of-pocket costs you spent for the year. Well, with Medicare prescription drug plans, there's multiple phases that you have to deal with, right? So as you look at this chart, your first phase on the bottom here, most plans are going to have some form of a deductible that you have to meet. After the deductible, you go into what's called your initial coverage. Initial coverage is the one that most mimics an employer plan. You have set co-payments, a set copayment for a generic, set copayment for brand name. But what happens, and the difference with a Medicare plan, is once you reach a certain dollar amount, which is based on the retail cost of the prescriptions, you go into what's called the coverage gap. In the coverage gap, you no longer are paying a flat copayment. You now start paying a co-insurance for the cost of the prescription. And unfortunately, if you're dealing with a very expensive prescription, that co-insurance gets very high, can get very high. So there is some relief once you spent, as you see the chart here, once you spend $7,653.75, it's very specific, you go into what's called catastrophic coverage. In catastrophic coverage, now the cost of all of your prescriptions drops down to 5%. To the point that you were making, as far as prescriptions being much higher, one of the big things that we do when we're doing our analysis, when a person is looking to compare employer coverage or staying on some type of retirement coverage, prescriptions is a big part of that. Because if a person is taking a lot of high-end prescriptions, although they may be saving a lot of money on premiums or co-payments on the medical side, we have to factor in what their cost would be on prescriptions. You know, if you're taking a prescription that's $1,000 per month, it will make a big difference as far as what direction you want to go in. All right, so we talked about the different options, so we'll talk a little bit about supplements. Again, the advantage of supplements is it's going to be one set amount that you pay per month, and just about all of your costs are covered. So you don't have to worry about any fluctuation. You don't have to worry about any high out-of-pocket costs at any point in time. It gives you total flexibility to see doctors in facilities anywhere in the country. You never have to worry about referrals or networks or anything of that nature. So, and you do have to add a separate prescription drug plan when it comes to that. There's a lot of different types of supplement plans, but I would say that there's probably a couple that are your more basic ones, right? So everybody is probably very familiar who has a supplement or done any supplement shopping in the supplement plan app. Now, one big change that's going to happen coming up in 2020. Supplement Plan F was the most common supplement plan because it's the only one that covered 100% of your costs without any deductibles. There's a new law that passed where Medicare is going to require all plans to at least have a minimum deductible that a customer is responsible for. They want everybody to have a little bit of skin in the game. So what's going to happen is anybody that's aging into Medicare after January 1st of 2020 will no longer be available to purchase a Supplement Plan F. Your new most comprehensive plan will become Supplement Plan G, which is very similar to F. The only difference is you have a $185 deductible that you're responsible for the year. Now, over the last couple of years, knowing that this change was coming up, we've pretty much been putting all of our customers on Supplemental Plan Gs to make sure that they're well prepared for the change. What I would recommend is any clients that are on the Supplement Plan F currently to call us and find out about if there's an ability to be able to change to a Supplement Plan G. Here's the reason why. Even though you will be grandfathered in and will be able to keep your Supplement Plan F, as your group starts aging, the cost of Medicare, or cost of healthcare will get more expensive for that group, and the rates will go up disproportionately to all of the other supplement plans. So you'll start, the gap between a Plan F and a Plan G will get wider and wider. So if we can, based on your health being able to pass underwriting in the state that you're in, we would attempt to try to move you into a Supplement Plan G, which would better situate you in the future for keeping your premiums down and keeping you in a plan that's more consistent in price.
But if someone did want to maintain that Plan F and they were already enrolled, would they be able to for 2020?
Yep. Everybody that has one will be grandfathered in. So nobody's going to lose a plan that they're already on. But again, the concern is that the rates will just kind of go up. You know, over the next year or two, it won't be so drastic, but, you know, 5 years, 10 years down the line is where you would notice a more substantial difference. But yeah, everybody that's on it, you're not losing it. You're able to stay on it for sure.
Cool, thank you.
Your second option, as we discussed earlier, is going to be your Medicare Advantage plans. And for the most part, there's two different types. Your HMO, which is your health maintenance organization. Those are plans where you have to have a specific primary care physician, and you have to get referrals from that particular doctor in order to see specialists. The more flexible one is your PPO, or your preferred provider organizations. Typically, those are most commonly are the ones that employers have for their employees as PPO plans. You can go directly to doctors without having to get referrals. You typically have a wider variety of doctors to choose from. So these options fit a specific need. If there are customers that are concerned with not wanting to pay a high amount in premiums and they feel like they're pretty healthy and they're okay with paying some co-payments as they go along, these plans in most areas start as little as $0. So that's the advantage of them, is you pay very little in premium The disadvantages, you do still have co-payments and costs that you're responsible for. And the other disadvantage is that you do have to make sure that any doctors that you're working with participate in the network, because you are limited to doctors that are going to accept that type of a plan. So it is a good option for people that are healthy. The concern would be if later on you wanted to switch to a supplement plan, depending on the state that you're in, that might be a problem. So those are all things that we consider when we're doing our analysis for the customers. We'll kind of give them the short-term benefits, and we'll also look at the long-term benefits and what are some of the concerns that they might have depending on what plan they choose. But that's going to be your second option. Your first option doing supplement, your second option doing some type of Medicare Advantage plan. All right, here's a breakdown of the different type of Medicare Advantage plans. The other nice thing about Medicare Advantage plans is they do typically include a lot of ancillary benefits. Most Advantage plans are going to include some coverages for things that Medicare doesn't cover, like dental, vision, hearing. A lot of them will offer gym memberships. A lot of them will offer money for over-the-counter products and stuff like that. So they try to make packages of these plans that are have a lot of different things to entice people into enrolling into them. And again, it may be a good fit for a specific type of person depending on what their needs are. Now, during the course of the year, depending on what type of plan you're looking at, there are specific time frames on when you can and cannot enroll into a plan. So the first one is your initial enrollment period. That's when you're first going on to Medicare A and B. Now, the charts that you see here are relating to Medicare Advantage plans, but we'll also talk about how that relates to supplement plans. But first, when it comes to Medicare Advantage plans or prescription drug plans, you have your initial enrollment period, 3 months around your birthday where you can enroll. Then you have your annual enrollment period that happens at the end of each year from October 15th to December 7th, where if you already have an Advantage plan, you can change to another Advantage plan, or you can change from prescription drug plan to a different prescription drug plan. Last year, Medicare added the open enrollment period. That's going to be an option for people that enroll into a Medicare Advantage plan and either want to change to a different Medicare Advantage plan because they feel like maybe they made a mistake on their choice, or they're having second thoughts and they want to go back to original Medicare and go back to a supplement plan. So Medicare allowed for that additional 3-month period in the beginning of the year to kind of fix any mistakes that anybody made in their choices. You also have special election periods during the course of the year for any circumstance that changes. For example, if you move, if you lose any kind of coverage, if you recover through an employer and they're retiring. So there are different circumstances during the course of the year that would also allow you to make changes. When it comes to the world of supplements, a lot of people get confused in thinking that the annual enrollment period applies to supplements. It does not. You can change your supplement plan anytime that you want, but in most states, you would be subject to medical underwriting in order to make the change. So if I'm on a supplement plan now, I feel like I'm paying too much. I find another supplement plan that has a better rate for the same plan. If I wanted to change it and have it start October 1st, I can. I just have to be able to pass medical underwriting. The company has the choice of not accepting a person based on their circumstances. Other than that, sorry, go ahead, Callie.
So you can, just to clarify, you can change your supplement policy at any time, but will it go into effect as soon as you're through that underwriting process, or does it wait until October of that year to update?
It starts the first of the following month. So if we did it, if I was looking at plans in March, I can have it start April 1st. So yes, you're free to have that start any time during the course of the year. Typically, the companies do make you wait until the first of the next month. So.
Thank you.
Now, with a supplement plan, the only time that you are protected, where you do not have to do any medical underwriting, is when you're first going on to Medicare. There's two circumstances revolving that. One is when you're turning 65 and you're going to retire at that time. The second would be if you are turning 65, but you're going to delay that. So let's say I'm not going to retire and now I'm 68, but I am either losing coverage or I'm just starting my Part B now. You're guaranteed acceptance into a supplement plan regardless of what your health is. So Medicare does protect the person who's going on to Medicare for the first time and transitioning their coverage. So you don't have to, at that point, you do not have to worry about any medical conditions. There are no pre-existing, there are no waiting periods, you're accepted 100%.
But that changes if you don't enroll immediately, is that right?
Yes, if you miss that window, and let's say you decide to go with an Advantage plan, 2 years, 3 years later you want to switch, correct. You no longer have that flexibility of being guaranteed to switch. Now you're kind of having to make sure that you pass that underwriting in order to make that switch. So eligibility-wise, now, as you can see, there's multiple scenarios for when your Part A and your Part B would start. In some situations, it starts automatically. In some situations, you have to apply for it. The rule of thumb that I'll give our customers is this. 3 months before you are looking to make the switch, that's when you want to contact us. Because based on your circumstances, we'll recommend what the steps you have to follow in order to make sure that your Part A and your Part B are going to go into effect. A lot of it depends on how old you are, if you delayed your Part B, if you have a spouse that you were still waiting for, whatever the case may be, we'll walk you through what's going to happen automatically and what you're going to have to apply for. The other thing is we're always going to recommend that our customers do set up a meeting and talk to someone in Social Security. We can advise and we can kind of give some of the basic parameters, but Social Security ultimately makes the final decisions, and every state's a little bit different. So we'll kind of give you the timetables and make suggestions of what directions to go in, and then you'd want to solidify that by meeting with someone in Social Security. There are some customers that have unique situations that are going on, and we want to make sure that they get everything started in a timely manner. So, but 3 months out is when you really want to contact us and start the ball rolling, start getting the information that you need, and making sure that you have all the things in place so that you have a smooth transition. So there are some enrollment penalties. For the most part, you know, when we're dealing with our Raymond James customers, we never really have to talk about this too much. As long as you have some type of credible coverage, you're never going to have any type of enrollment penalties. The one question we do get from customers is, if I don't want to go on Medicare, am I allowed to stay with my retirement, with my group plan, my employer plan, my retirement plan? Absolutely. If it makes more sense that you have to stay on there, maybe you have a spouse that hasn't aged into Medicare yet and they need to be covered under the umbrella of the policy that you have, it makes more sense for you to stay there. But as long as you have credible coverage, whenever you do ultimately transition over to Medicare, you would not have to pay any enrollment penalties or any fines or anything like that.
We advise clients to communicate with Medicare even if they don't plan on using the coverage and are sticking with their employer. Is that still a best practice, or is it unnecessary?
Yes, it is. If the customers haven't received a package from Medicare where they fill out the form and opt out of Part B or are able to update their status with Medicare, I would definitely recommend that they contact Social Security. It can always be fixed, but you never want to start getting charged for example, you don't want to start getting charged for Part B if you're going to stay with your employer plan, because you're duplicating coverage, so you're paying it for no reason. So if you do get typically what happens is 3 months before you turn 65, you get a package from Medicare. And in that package, you're able to fill out whether you're going to start your Part B or whether you're going to delay your Part B. If they get that and they turn that in, probably a phone call to Social Security just to update to make sure is enough. But yes, if they don't receive a package from them, I would definitely recommend them reaching out. Medicare doesn't have their proper address, whatever the case may be. Medicare is going to make the assumption that you're going to want to start A and B, because most people are not going to want to not have coverage. And Medicare cannot make the assumption that you do have other coverage. So they're going to always add A and B unless they're notified otherwise. So yes, it is a great point, Kelly. They should probably be communicating with Social Security, even if they're not going to take it, just to make sure that everything's up to date.
Thank you.
Absolutely. So this tells a little bit about our story, and we talked a little bit about this in the beginning, but when you're dealing with one of our agents, you know, we have a very select group of agents that deal with Raymond James. They're used to the type of questions that our Raymond James clients have, which, you know, it is a little bit unique to the average person that's out there. There's different concerns with Part B premiums and taxes and different things like that that we normally wouldn't have to deal with other customers. We do have facilities across the country, but again, we only have a core of 35 agents that are the ones that are handling the Raymond James clients. Again, a little bit more about our company as far as the scope of the size, as far as the carriers that we work with, as far as the selections that we offer. And customer satisfaction is a huge thing with us, particularly with our Raymond James clients. I think our success with Raymond James has been based on the fact that, you know, our customer service has been, we hold ourselves to very high standards when it comes to our customer service with our clients. We work with very specific, we know that our Raymond James clients have very specific schedules, and we do everything possible to accommodate any of the needs of any of our clients have, including if they need appointments on Saturdays and Sundays or late evenings, we always accommodate whatever the customers need from us. So, and that's helped the relationship with Raymond James become bigger and bigger, and more advisors every year take advantage of our services. So here's a kind of an idea of the different carriers that we work with. But again, I want to thank Callie for the opportunity to discuss and be a part of the webinar. I have the phone numbers here. If you can have two options of what you can do, you can contact us directly, and you will be automatically, that number gets you directly to one of our agents that works specifically with Raymond James. So you will get one of those agents by calling that number. And of course, you can always go directly to your advisor and have them call us on the three-way call to get everything set up if you feel more comfortable doing it that way. But either way works perfectly for us. But Callie, thanks again for the opportunity to assist with the webinar. It's my pleasure to help you today.
Thanks, Joel. And is there anything that clients should have prepared before they call that HP1 number? Any kind of information that they should, or questions that they should be ready to answer?
Yeah, great question. Absolutely. So the main thing for the initial one is, particularly if a customer is wanting to do a comparison of what they have versus what they can get, I would say a great thing for the customers to have would be some type of information on the plan that they have and how it works. Also, a list of any doctors that they're concerned about, and a list of prescriptions. Those are the things that help us to really do a breakdown of the different plans. So great question. Those would be some of the things that I would recommend to have available. Okay.
And another question our listeners might be wondering, how is HP1 compensated?
Great question. So yeah, it doesn't cost the clients anything. Whatever plan that we ultimately choose, that plan compensates us. But it's exactly the same no matter what company we work through. So let's say a customer sees a plan, they want to do an Aetna supplement plan, we would get paid by Aetna for enrolling a customer into a supplement plan. But the prices that you get from Aetna would be exactly the same as if the customer went directly to Aetna. So in essence, there is no additional cost to the client.
And is there any incentive for HP1 to use Aetna versus another carrier, for example?
None. It's exactly the same for us no matter what. We have no vested interest in what a person decides.
Awesome. That's great. Well, Joel, thank you again. And if anyone has any follow-up questions, we're not able to take anything live, but feel free to call our office or HP1 directly with the numbers on the screen. Thank you for your time, and I hope everyone has a great day.